This morning, the coronavirus crisis is escalating across America and in several other countries across the globe. Public health officials in the U.S. reported more than 62,000 new cases of the illness yesterday, and the nation's one-day death toll was 1,124. Now, that tops 1,000 for the first time in nearly a month. Wisconsin also reported its highest number of COVID deaths in a single day. In a CBS News exclusive and an important one, Adriana Diaz went inside one of 5 COVID units in Wisconsin's largest hospital to see what patients and medical teams are up against.
Hi, Sue.
Hi.
How are you?
73-year-old Sue Pappas says she did everything she could to protect herself from the coronavirus. That's why she's angry. She still ended up in the ICU at Aurora St. Luke's Medical Center in Milwaukee.
What do you say to people who don't believe this is real?
I don't know what to say to them. I'm sitting here, I'm sicker than a goddamn dog, and it's real.
How do you think she's going to do?
I feel good about her. I really do. It's hard to say, though, because we've seen patients that hang out and on high oxygen for weeks, and then they require intubation, and it happens fast.
Ashley Bonus is one of Pappas's nurses. She's also 17 weeks pregnant.
I struggle with going to the gas station and someone's not wearing a mask because I am a diabetic. I am a pregnant woman. Like, I'm risking more going to the store than I am coming to work because I know that we're all 100% protected here.
In the past month, the number of COVID patients here has more than tripled. This patient has been intubated and sedated and has been here for 2 weeks.
1, 2, 3. The reason why they're flipping him is because proning, as it's called, or flipping patients, has been shown to help patients breathe better. It's one of the proven ways to help them survive.
Dr. Charles Ogello, who secured the patient's head, worries about the staff.
At some point, fatigue begins to set in. How do we keep our staff refreshed and able to continue to do this since it's lasting longer and longer?
It's been a marathon.
It has been a marathon, and we don't know when it's going to end.
Despite the uncertainty, the nurses and doctors here say they're fueled by the people they're able to save.
When we started this, I asked my husband, who fought in the war in Afghanistan as a Marine, how do you prepare for this battle? He told me to figure out what you're fighting for and keep that at the forefront. So this community, these patients, these families that are being affected by this, that's what I'm fighting for.
For CBS This Morning, Adriana Diaz, Milwaukee.
Wow, you cannot but help but think about Ashley Bonus there, Tony. I mean...
Oh, absolutely. And you know, I said at the top that was a CBS News exclusive and an important one. The reason I think it's so important is because we have covered grieving families. We've covered people who have recovered from the virus. But what we're seeing, and it is rare, is actual patients struggling. And I think that brings it home for Americans who may be still thinking, you know, I don't see it in my community. What's really going on here? Well, we just showed it to you.
And frontline workers struggling. A reminder, Ashley Bonus is diabetic, a nurse working in the hospital, diabetic, and 17 weeks pregnant.
And that's why, guys, it's so hard to hear people say we've rounded a corner, we have it under control. Try telling that to the people on the front lines that are dealing with this on a daily basis. It's very much alive and thriving in this country. Please don't forget that.
An important story by Adriana there.